from people. Let's leave a few minutes, say 5, 10 to have more participants.
Clearly.
Yes, sir, we can hear you, sir.
Right. Okay. Thank you. I'm very privileged to be one of you this afternoon, and we note the good work being done by the YOF. I think you recently had a forum with the Cornell Bank, because
Yes,
I discussed with the director of the bank recently, and she did mention your meeting.
Yes,
Dr. Kule Hassan, the past president, has offered a very good gesture for registration for the African Ophthalmic Council, which I've discussed with Dr. Eze. I know he's communicated with everybody and given me feedback. It will be good for us to use this opportunity to try and put Nigeria in a rightful place on the African map in ophthalmology. So you will not only be representing yourselves, you'll also be representing Nigeria, because in a few years' time, you are the ones going to be the power blocks of the OSM. I pray you have a very good deliberation today. I will stay in for some time. I have another Zoom meeting going on, but I'll stay in on this one until I really have to leave. So thank you very much once more for giving me the opportunity. Thank you.
Thank you, sir. We appreciate you, sir. Thank you. At this point, I think we'll start our meeting. We have 10 participants now. We'll start our meeting, and I will briefly introduce our speaker. Our speaker for today is Dr. James Ajige. He's a consultant ophthalmologist at the Dalhatu Araf Specialist Hospital, Lafia. Somebody a good number of us know very well. An amiable colleague. He's been part of my training, and I believe we're going to have a very good time with him today. So thank you, Dr. Ajige. Next few seconds, the stage will now be yours.
I want to thank you very much, the President, for giving me this welcome and for inviting me to speak on this auspicious occasion, the World Sight Day. And you've asked me to present something that revolves around the theme of the World Sight Day, which is Love Your Eyes. I will do my best, and we'll see where we can take it up from there. Thank you very much.
Thank you, sir.
So, I thought it wasn't moving. I intend to discuss the theme using this outline. I'll give an introduction, speak a bit of epidemiology, and then I'll discuss the 4 Ps to love your eyes, which is the main thrust of this discussion. And then I will conclude. As a way of introduction, the World Sight Day is a day that is coordinated by the International Agency for the Prevention of Blindness in collaboration with other international partners like the WHO, and is commemorated every second Thursday of October. This year's fell on the 14th of October, which is Thursday last week. I find it interesting that we are discussing World Sight Day some 3 days afterwards, Actually, if you allow me, I would say it should be a World Sight Month. After all, if glaucoma can occupy an entire week, why wouldn't the Sight Day occupy the entire month? So activities around this day is also welcome. As stated initially, the theme for this year is Love Your Eyes. And it actually centers around being aware of our eye health. Let me at this point paint a little scenario, and indulge me please to involve your imagination. As you're seated in your various locations, imagine for a moment that you start to perceive a stench, a sort of smell that you couldn't place. One of the things you do is to rove your eyes around to find out what is that. As you're trying to decipher what exactly and where that smell is coming from, you now hear a roar. Now that roar startled you. And as you are trying to gather your emotions and think of what to do next, you see a lion. Now, when you see a lion, would it be, what would be your next reaction? Would you also want to touch to be sure that it's a lion? I bet for any of us, what to do next will be clear on how to protect ourselves. I bring this up to show the importance as a sense organ the eye is. The eye is said to, or the vision is said to be an organ that contributes to up to 80% of the information we gather. So it is that important. And that's why when I saw the theme, Love Your Eyes, it became so apt. Of all the organs of our body to love, I think the eye deserves that much attention. And so the call to attention is that everyone counts. Indeed, this shows that nearly everyone in his lifetime would experience some form of eye health issue. And amongst those who presently have eye issues, over 1 billion of them have no access to eye care services. Now, this slide talks to the range of people that are affected by eye health issue. For children, when they have a good eye health, it gives them a chance to reach their full potential. For workers, it's important that they are supported to be able to work optimally when they have eye care enabled workplaces. For the older persons, they will be able to participate fully in the society. And then disadvantaged ones are given greater access to eye care services. The health system will function better if primary eye care is incorporated into the primary care centers. And then globally, there'll be a boost of economy as the productivity increases and as we all target to meet with the vision of the SDG. Globally, it's estimated that 2.2 billion people have either near or distant visual impairment. Now, out of these 2.2 billion people, about half of them experience visual loss, primarily because they don't have access to eye care services. And this is of importance to us because over 90% of those with this visual loss live in low and middle income countries in which ours is part. It's also important to note that majority of people with visual loss are 50 years of age and above. And a slight majority of them are women. Now, if the trend is left unchecked, the number of people with visual loss, that is those with visual impairment who don't have access to eye care service, is estimated to increase from the about 1 billion we have presently to 1.7 billion people by 2050. And this is mainly because of population growth and aging. In this slide, we see a woman who is using glasses for her daily chores. She's picking stones out of rice. We used to stress on distant vision, but poor near vision is also an issue, because if she doesn't pick the stones out of the rice which is available to her, her family would no longer enjoy eating from her hand. And that may create a strain on her marriage and on her family relationship and on her happiness, generally speaking. It's also important to note that people with near visual limitations, they need to have access to care, because sometimes their occupation is also involved, like those who are sewing. Unaddressed poor vision results in an economic productivity loss, as estimated to be of about $411 billion per annum. And it's noted that over 90% of visual loss could have been prevented. Now, it's important to note that although visual loss affects adults more, the impact on children is even higher. When children are faced with visual problems, they have a higher chance of mortality. And so it is estimated that, generally speaking, poor health leads to up to 2.6 times mortality. And much of this is attributed to childhood blindness. Children with a visual impairment are up to 5 times less likely to be in formal education, and they achieve poorer outcomes, generally speaking. Now, these are some of the causes of visual impairment globally. Unaddressed refractive errors. We have discussed that this encompasses both distant and near visual refractive errors. Cataract is second. Age-related macular degeneration, glaucoma, diabetic retinopathy, corneal opacity, and trachoma. Now, this is generally speaking because the various regions of the world have different diseases that rank first and of more importance than in other regions. In Nigeria, for example, the various causes of mild, moderate, and severe visual impairment shows that the refractive error, uncorrected refractive error, accounts for over 60%. Now, this was the finding from the National Blindness and Low Vision Survey that was conducted more than 10 years ago. It also showed that following that is cataract, and then uncorrected aphakia and glaucoma. The causes of blindness, however, is attributed more to cataract. 43% is due to cataract, 16.7% to glaucoma, which is the commonest cause of irreversible blindness. Next to it is uncorrected aphakia with 8.4%. 7.9% is attributed to corneal opacities of various causes. It could be trauma or some other non-trachomatous causes, like measles, vitamin A deficiencies, and all of that. 4.2% is due to trachoma. And then others like age-related macular degeneration, refractive error, and onchocerciasis are also other significant causes of blindness. We can see that cataract is a major issue when it comes to blindness, and the only treatment available for now is surgery. We want to now talk about how we can love our eyes. The International Agency for Prevention of Blindness have proposed 4 Ps to love our eyes. And in truth, when we follow this idea, we will be able to preserve our vision. Now, the 4 Ps encompass prevention, protection, preservation, and prioritization of vision. Let's talk about what we can do to prevent visual loss. There are two things basically. The first is to eat healthy, and the second is adopting a healthy lifestyle. Please, just a minute. There are two basic ways to prevent vision loss. The first is to eat healthy. Now, eating healthy means to eat a healthy, balanced diet. A balanced diet is defined as a diet consisting of a variety of different types of food, providing adequate amount of nutrients necessary for good health. And so we'll be talking about some kind of diet that is important and more important when we are discussing eye health. Basically, a healthy, balanced diet helps us to maintain weight, controls obesity, and prevents such diseases that have a direct impact on our eye health, like diabetes, mellitus, and hypertension. Let's talk about vitamin A. A healthy diet provides vitamin A, and vitamin A supports the health of the cornea and the retina. We do know that vitamin A is important to epithelial tissues, and so tissues like the conjunctiva and the cornea and also the retina do well with a handsome supply of vitamin A. And we have good sources of vitamin A in green leafy vegetables like spinach, in eggs, in sweet potatoes, and in other foods like carrots. This picture shows some of the things that provide a good supply of vitamin A. Also important to our eye health is vitamin C. Vitamin C is said to delay age-related diseases such as cataract and age-related macular degeneration. Now, I want to state here that some findings have found out that a good, healthy diet that involves vitamin A actually delays the onset of diseases like cataract. For example, the Indian study on age-related eye disease shows that individuals with normal plasma level of vitamin C and also a good vitamin C in the aqueous humor, they have less chances of developing cataract as against those with a less amount. The same findings is also seen in the European eye study. The question I want to state is that these studies concentrated on foods that people eat that is rich in vegetables and fruits and that supply vitamin C. It's not supplements, because studies like Araf, that is the age-related eye disease study, shows that supplements of vitamin C has no impact on prevention of cataract. Also, the Roche European American clinical trials, which also used supplements of vitamin C, vitamin E, and beta-carotene, shows that there is no relationship between the use of supplements and cataract. In fact, some studies suggest that increased use of high dose of vitamin C and for a long time increases the risk of cataract. So the discussion here is about foods, not supplements, so that people don't become deceived into buying supplements that they would cure or delay onset of cataract. And we do know that healthy diets that supply vitamin C is good in preventing age-related macular degeneration, as it's very much shown in the RH study. The picture here shows some of the sources of vitamin C as seen in citrus fruits, in tomatoes, and in strawberry. Vitamin E is also another antioxidant that is good for the eye, and it helps in preventing or delay the onset of age-related diseases like cataract and ARMD. And the sources are seen are almonds and sunflower seeds. Notice that most vegetables and fruits actually contain all of these nutrients in various amounts. Omega-6 and omega-3 fatty acids are also very good sources of eye health, and they lower the risk of dry eye and promote a healthy retina. A good source of omega-6 and 3 is cold water fish, but then we can also get them from a handsome supply of fruits and vegetables as seen. Lutein and zeaxanthin are also known to delay onset of diseases as ARMD, and dark green vegetables such as broccoli are known to be a good supply of these. The onset of the pandemic brought about zinc as a topical issue, and we do know that zinc is good for epithelial tissues, as it also supports the health of the retina. We have both plants and animal sources of zinc as found in beans and in legumes. Now, apart from eating healthy, another thing that could help us prevent visual loss is adopting a healthy lifestyle. And by this, we mean stopping smoking and cutting down on alcohol, so that we take only a moderate, if we must, a moderate drink. Exercise is also emphasized, at least 30 minutes a day for 3 to 5 times in a week. And it's also good that we know our numbers. Our numbers meaning what is our blood sugar, what is our blood pressure, and our cholesterol level. This has eventual impact on our eye health. So maintaining a good health by exercise is important. It's important to note that an active lifestyle may not necessarily be exercise. So if you are busy every day, it's important to squeeze in some time. Maybe wake up a little early and do some exercise. It may be in the house. It's better than nothing at all. And it could be fun when the family is involved. I want to talk to the second piece that shows that we love our eye, and that is to protect our eyes. There are things that could harm our eyes, and one of the risks is the sunlight. Now, the sunlight has ultraviolet rays. Although much of it is absorbed by the ozone layer, some do reach the earth, and it could lead to various eye diseases as shown. Photokeratitis. Photokeratitis has been described in what is known as snow blindness. Now, because of the way snow reflects sunlight, when people go to the Arctic or Antarctica to ski during spring, it has been known that some of them came down with photokeratitis. It's also seen with welders when maybe their protective goggles is not worn, it could affect the cornea. For us in the tropics, we are particularly interested in pinguiculum and pterygium because these are quite common. And we do know that because we have a handsome dose of ultraviolet rays here, we see this quite commonly. Other things that the sunlight could lead to are climatic droplet keratopathy, cortical cataract. and luminescent cataract has been associated with higher dose of ultraviolet rays, especially in watermen. ARMD and solar retinopathy are also other diseases that are known to be associated with ultraviolet rays. So it's important that we protect our eyes from harmful rays from the sun. It's also important if at our workplace we have things that could impact on the health of our eyes. So we need to protect our eyes from workplace accidents. Our workplace have chances of spillage or exposure to harmful radiations or to foreign body. We would also discuss how we can protect ourselves from prolonged exposure to screens. But how can we do this? Generally, it's in three ways: the use of protective eyewear, use of clean cosmetics, and working in a body-friendly way. The use of protective eyewear can help all of us when we are going out in the sun. Because when we step out of the sun, we get exposed to sunlight. And then the sunlight has ultraviolet rays. It's important that we use protective sunglasses. Protective eyewear could also be used in workplace where it is recommended, especially where known hazards occur, as chemicals or flying particles or excessive heat, or among the welders. Now, this slide speaks to what occurs in the environment. Notice that different environments we find ourselves exposes us to different doses of ultraviolet rays. It's not usual for us to walk into the sun and to look directly at the sun. We wouldn't do that now, would we? And God has made it such that we have an eyebrow, we have a forehead, and then the bones of the face protect us from direct rays from the sun going to the eyes. Much of the rays that go into the eye is a reflection from our environment. And so the first picture shows that the reflection from a grassy environment is the least. Where we're in grassy pastures, only 1% of the sun is reflected back to us. The sand and concrete reflects up to 10% of light, while water body reflects much more, up to 20%. That is why cortical cataract is usually seen in these people, because they are more exposed to ultraviolet rays. The fourth diagram shows historically what happens to people when they go to the Arctic or Antarctic during the spring to ski. The snow reflects up to 88% of the sun rays. And when their eyes is exposed to this reflection, it can lead to direct damage of the cornea, leading to photokeratitis. Here we see the various ways in which we can protect our eyes. When we are indoors with some rays of the sun, up to 4% can get to us. But when we are outside, we are exposed up to 72% of all the reflected rays to the eyes. Using protection like glasses or indeed glass and a hat would give us a better protection. So this shows that one of the ways in which we show we love our eyes is to use these protections. Here we see that in our various workplaces, there is need to use the recommended eyewear. A welder here is using the recommended eyewear, not just a sunscreen. In our environment here, we have an agrarian society where they like farming rice. And we have seen a number of corneal ulcers, hypopion corneal ulcers, some so bad that the eyes need to be eviscerated when they are harvesting rice. Foreign body or the band from the rice gets stuck to their eyes. And before they come to the hospital, they've used all sorts. So we've gone on air, especially in these seasons of harvest, to tell them that there is an agricultural eyewear that can be used for harvesting and which can protect the eyes. So these are some advocacy tools that would help us and others to protect our eyes. The protection of the eyes also relates to cosmetics, and this is more to the women. Although in our environment here, we see mothers putting cosmetics, they call it tozeli. They put it in the eyes of babies, both boys and girls. They say it makes the eyes to shine. Well, but for the purpose of this discussion, we do know that ladies use cosmetics a lot to the eyes, be it mascara or some form of eye salves. Now, the advice here is to use a fair amount of cosmetics in consultation with your eye care professional, because when it's inappropriately used, it induces the eye to some ailments such as dryness and allergic reactions. This is not an uncommon sight if you are used to inverting the eyelid to examine the tarsal conjunctiva on ladies, especially presenting with recurrent allergic symptoms. So the proper advice would be given. Protection of our eyes also comes in on the way we use screen. The use of screen has increased over the years, especially during this pandemic, as we are now having this discussion over Zoom. But it's important to use screen in a way that will protect our eyes from what is known as the computer vision syndrome or digital eye strain, with symptoms as strains, headaches, dryness of the eyes, and musculoskeletal issues. What is known is that when you're using the computer or your set, the rate of blinking drops. Usually we blink at about 15 times every minute. Now, when that reduces, the rate at which the eyelid cleanses off any debris that is attached to the globe goes down, and that predisposes the eye to dryness and other allergic symptoms. So the advice is to ensure conscious blinking when you are using the screen. The 2020 rule has also been proposed. And this essentially means that after 20 minutes of using the computer or whatever device, we look away, 20 feet away for 20 seconds. That would ensure that we don't put so much strain on the eye and we don't expose ourselves to too much of the glare that could come from our monitors. It's also important to have a good posture when we are using the computer, especially for a long time. Back in the day, we used to use folders for patients, but many hospitals these days use the electronic medical records. And so even at workplace, we would be on hours using the screen. So it's important to posture ourselves well in order to minimize musculoskeletal symptoms. This slide shows some of the things that we can do. We should ensure that the monitor is about an arm's length away. And then the level of the monitor to our eye should be such that our eye level is a little above it, or at worst, at the same level as our monitor. Our arms should not be too far away. That is, our elbows should be close to our bodies and not stretched out. And then the wrist should have a minimal bend. We should ensure that our back is straight and it's well supported. The feet should be flat on the ground or resting on a footrest. And then our chairs should be such that it is not impinging on the back of our knees. Now, this is important because musculoskeletal symptoms as well as eye symptoms have been described when we don't use or we don't monitor, we don't position ourselves well when using the screen. So this is a bad posture that we want to avoid. This picture, this diagram speaks to why it's important that our screens is not elevated high above the eye, such that the eye has to be rotated upwards. Because in the normal adult life, the eye is usually set slightly lower, what is known as the angle of pantoscopic tilt. That's where the idea is. That's why glasses are given that tilt in order to follow the natural flow of the eye. So, but if our monitor is elevated above, it therefore means that our extraocular muscles are doing more than necessary work, and that would increase our eye strains and perhaps a headache. So we have discussed the first two P's, how to prevent and how to protect our eyes, showing that we love our eyes. Now let's talk about preserving our vision. In order to preserve our vision, it's important that we plan and get a comprehensive eye exam. It's important to note that even we as doctors and ophthalmologists, sometimes we don't get our eyes checked even while looking at the eyes of others. But we want to plan every now and again, stop and get our eyes checked. And that would include having a folder in which our detailed medical history will be recorded. Our family history will be noted. We would have visual testing, which include, but is not limited to, visual acuity testing. And then we should have a refraction done. It's important. And then a dilated eye exam when necessary. The World Sight Day is actually an avenue to have our eyes checked. Now, the fourth P talks about prioritizing our vision. We need to prioritize our vision. It's not only on the World Sight Day or around the World Sight Day. We want to ensure that these four Ps are part of our routine. And we want to make eye exam part of our medical examination. And so we want to have our vision as part of our life mission, educating our family and loved ones, and also be an agent of advocacy to the community. When should we get our eyes tested? It is suggested that at least once every 2 years. However, there are reasons why it should be done even more regularly than that. If we have a pre-existing eye condition and we are seeing an eye doctor and he has asked us to have an appointment, it's important that we keep to that schedule. We shouldn't say it is once every 2 years. We're exempted from that. And then there are factors that will make us to go for an annual eye check, not once every 2 years, but once a year. And the first one is if we are 40 years and above. They say life begins at 40. Yeah, so at 40, we should have an annual eye check. When we have a family history of glaucoma, if we have diabetes or hypertension, it's important to have an annual eye check, which should include a dilated eye exam. If we have a history of chronic smoking, or if we have high myopia. Now, apart from these factors that would make us have eye check once in every 2 years or every year, it's important that we advocate and we notice symptoms that will make us rush. There are red flags that would demand an immediate eye exam, such as flashes of light, sudden loss of vision, redness, eye pain, seeing colors around light. Now, I want to take a moment to speak on eye health as it relates to children. I wouldn't spend much time on the 4 Ps, but want to note that it's important that children eat healthy. If it is important for adults, it's even much more so for children because of their love for sweet things. It's important that parents oversee what their children eat because it's not just important for their overall growth, but also for their eyes. The incidence of myopia is seen to be increasing, not just in the Asian world, but also in our own setting. And one of the things that has been linked to myopia is indoor activities and increase in using the screen or near work. So it's advised that in order to reduce incidence or reduce the likelihood of our children having myopia, they spend at least 1 to 2 hours every day outside. Let them go and play outside. But I will state here that it is a challenge in our day and age. Yeah, because of the issues of security. Back in the day, children are left to play outside for hours on end. In fact, when they come into the house, the question they will ask is, what are you doing? Go and play outside. But these days, if the children want to go outside, the question is, where are you going to? Come back inside. But it's important for us to note that it's good for children to spend some hours outside in the sun, and then to schedule for them to have also a routine eye exam. This was what was common back in the day, but not much so in these days. There are also signs that would tell us that it's important to have our children go for an immediate eye exam. If we have a child that is preterm or that has other developmental abnormalities, if in the family there are siblings or even parents who use spectacles, it's important that they get their eyes checked. If the child has to reduce his palpebral fissure in order to see, or constant rubbing of the eye, or when a child has to go close to the television or brings his books very close to the eye in order to see, are signs that he needs his eyes checked. Others are redness and watering of the eyes, and then abnormal head posture. It's important for us as ophthalmologists to be able to pick the signs of abnormal head posture. Also, constant headaches and eye strain or seeing double or deviation of the eyes are signs for immediate eye exam. I would want to conclude that the eye is an important organ of the body. Indeed, up to 80% of our interaction with our outside environment is brought in by means of our sight. So that shows how important the eye is for us to love and to cherish it. In our environment, we have a huge burden because we don't have the best of eye care, yet we have a huge burden of visual impairment. And so it's important that we become agents for advocacy and for care, and to let people know that prevention is better than cure. it's better to have your vision than to have a visual impairment, because access to care is not the very best. And so let us all advocate for the practice of the 4 Ps. Let's care for our family and advocate for the vulnerable. I want to thank you very much for giving me this opportunity.
Thank you. Thank you very much, Dr. Ajige. Thank you for your lucid presentation. We appreciate you. At this time, we welcome questions from participants. You may put the question on the chat, or you may raise your hand.
I can't see any hand up.
No question yet on the chat room. Our distinguished resource person did justice to this topic. My opinion.
Thank you for your kind comments, Dr. Eze.
Thank you, sir. The take-home message here is that we should love our eyes. And in addition to that, as stakeholders, we should encourage people around us to do the right thing. To me, that's the message. I learned a lot today.